So just waiting for a few more folks to join in. Perfect. Hello, everyone. Thank you so much for tuning in. Welcome to our Oxfam Live webinar on Cancel the Debt. We're excited for you all to listen to this conversation. My name is Debbie Owusu-Acha, and I am a Oxfam campaigner here for Oxfam Canada, and I'm also going to be your moderator for today. So here's a little bit of how the webinar will work. There's going to be a moderated discussion with our guests. After the discussion, there will be a Q&A session where you, the audience, can ask questions to our guests. You can join the discussion and kind of pose your questions as we're kind of having our conversation in the chat box. And at the end, we are going to pose those questions to our guests and then hopefully have an awesome, fruitful discussion. So folks also know there are two folks who are behind the scenes kind of making sure that the discussion and Q&A run as smoothly as possible. They are Amanda Gom and Lucy Junot. I can assure you they are waving, you just can't see them, and that's okay. So now I am kind of happy to introduce our guests. Our first guest for today is Deanna Sorosi. Deanna is the Director of Policy and Campaigns. She's a longstanding feminist advocate with more than 15 years of experience working with non-governmental organizations in Canada and throughout Southeast Asia. At Oxfam Canada, she's advancing policy files related to economic inequality, gender budgeting, humanitarian assistance, peace and security, aid and foreign policy, and women's leadership, all with an emphasis on feminist approaches. She also focuses on targeting the Canadian government and multilateral fora. She is an ongoing analyst and commentator on Canada's federal budget. Our second guest is Victoria Harnett. Victoria works for Oxfam International as the head of public campaigns on inequality and is currently leading our public mobilization work in response to the COVID-19 pandemic. She first joined Oxfam as a regional campaigner and organizer for Ontario with Oxfam Canada in 2006 and moved to Oxfam International in 2012 to lead the development of Oxfam's global campaign on inequality, which includes supporting over 50 countries on issues related to gender and economic inequality. Awesome. Hi, Deanna and Victoria. How are you?
Hi, good. Nice to be here.
I'm excited to chat too. And so without further ado, we'll go right in. I'm going to pose my first question to Victoria. Victoria, why is the ask to cancel the debt important, and what's happening internationally to make that happen?
Thanks, Debbie, and hi, everyone. Welcome, and thanks for joining us. Well, we've all watched the coronavirus pandemic put a tremendous strain on even the strongest health systems and economies in the world over the last 3 months. So imagine for a moment what the impact could be like still in many countries, in poor countries around the world where the pandemic hasn't even hit its height yet. Countries like the DRC, where we've estimated that they have less than 10% of the doctors that they would need to adequately respond to a pandemic like this. Countries like Uganda, where there are only 55 ICU beds for approximately 42 million people. Or a country like Ghana, where the government spends 11 times more on debt payments each year than it's able to on healthcare. So when you look at the pandemic in that context, this is a really urgent issue. So, and even though the virus has wreaked havoc on all countries, we know that countries with healthcare that is universal and public, like here in Canada, are best placed to get through the pandemic and able to protect its people and keep them healthy and safe. Yet in most countries, health services are desperately weak. in most poor countries, health services are desperately weak and deeply unequal. So right now, in most cases, you can only get treatment in a lot of these countries if you have money to pay for it. And Oxfam firmly believes that healthcare is a human right. Everyone should have access to it free of charge. We've estimated that at the outset of this pandemic, the poorest countries in the world were set to spend roughly 40 billion US dollars on debt payments this year alone. So if we include poor and middle income countries in that number, so not just the most poorest, but other levels of poverty and development as well, that number more than doubles. So roughly 100 million US dollars just this year alone in debt payments. And that money is one of the only sources of revenue that countries could quickly reallocate to strengthen their health systems and fight the pandemic. Now, given how the pandemic has shaken rich countries, we can't possibly imagine, for example, being able to mobilize enough, for example, new aid in support of such an urgent need. So canceling existing payments that could be used to take that money into healthcare systems is really, really urgent. And Oxfam's been working with dozens of like-minded organizations already, including nearly 1 million people like yourselves, to call for canceled debt payments in 2020 so that healthcare can be made free for all who need it during the pandemic. I'll leave it there for now, Debbie.
Perfect. Thank you so much. And I absolutely agree. And I mean, with the work that we do with Oxfam, healthcare is a human right. And I'm actually glad to hear you kind of talk about the work that folks have been doing so far with all of the organizations and even individual advocates. And so I guess my next question is, like, what progress has been made so far with the Cancel the Debt campaign?
It's a good question. And unfortunately, in some ways, the answer is a little bit complicated. But within the first 2 weeks of launching this campaign, which was about a month after the pandemic hit a country like Canada, we went from 0 countries to 12 countries, and now 77 countries who are eligible for some kind of debt relief. And this debt relief for those 77 countries could total as much as 12 billion US dollars. So that's a significant step in the right direction, and something we've celebrated in 2 weeks' progress. That's massive, actually. However, not all is always as it seems. So, for example, this relief doesn't include all countries who desperately need the relief. There are over 100 countries that we're trying to advocate for. It also doesn't include all forms of debt. There are many. I won't go into the very fine details, but there are different kinds of debt in the way that the whole landscape of debt is structured. Loaning and debt is structured. And it includes a number of restrictions that are making it difficult for countries who are eligible to take advantage of it. So, for example, credit agencies not guaranteeing that if a country takes advantage of debt relief, that it won't still negatively impact their credit rating, so their ability to access loans in the future. And notice that I said debt relief. So forms of debt relief have been seen progress, but not debt cancellation. Most of what is being offered is a deferral of 2020 payments, which would actually leave countries worse off in the long run if they were just to defer payments that they then have to pay, in 2021. So let's face it, the pandemic's been raging for months, and its impact on poor countries is just beginning now. We're starting to see healthcare workers in some countries like Zimbabwe and Nigeria striking over their working conditions and unpaid wages. And that's at the outset of this pandemic. So definitely more action is necessary in the immediate term. In order to ensure that we're looking at real debt cancellation without restrictions and conditions that leave countries in a worse off place from now.
Thank you so much for being able to kind of paint the global picture and kind of give folks like myself who work at Oxfam and are still learning about these issues, but as well as like supporters and the broader public, a better understanding of what's happening internationally. Now, I think my question for Deanna, considering that we're here in Canada, we're working on this to make sure that Canadians are aware, or people who are living in this country. My question to you, Deanna, is why should Canadians care about debt alleviation globally? And, just like a random question to throw out there, because I know some people end up asking us when we do this work, is like, will this take away from like Canadian efforts domestically? So just why should we care, and does this take away from the work that's happening here at home?
Yes, of course we should care as Canadians. I think the most obvious reason is the pandemic knows no borders, and we are only safe when everyone around the world is safe, right? The former president of Liberia, Ellen Sirleaf Johnson, said, coronavirus anywhere is a threat to people everywhere. And so it's really it's one of those rare times when the entire world is in it together, right? And it's important that rich countries like Canada do what they can to mitigate and end this crisis. We know inequality is already at extreme levels, and unless we all work together, this crisis will only be exacerbated. Oxfam released a report just a little while ago estimating that as many as 500 million people will be pushed into poverty. So, really setting back the fight against poverty by a decade, and in some cases by as much as 30 years. Of course, we recognize that the need is big in Canada too, with rising unemployment levels. But we really need to recognize that Canada's health and economic recovery is dependent on the rest of the world's recovery, right? We're not separate from the rest of the world. Just to give one example is the women who make our clothes. So Canadian fashion brands rely on women workers in Bangladesh to make our clothes. Many of these workers have been living in extreme destitution for the last 3 months. They've not been paid for their work. They cannot work safely. And what's the worst part about it, there are no government supports in place for them to receive social protection like many of the Canadians have had over the last few months. And so what we hear from workers is that if they don't die from the virus, they will die from hunger. So if Canadian fashion brands want to survive this crisis, right, they really depend on their workers in their supply chains being able to make it through this as well. So we know poor countries need to scale up their health systems and provide social protection for those who lost their jobs. But considering Africa alone is robbed of at least $100 billion a year in taxes due to tax avoidance by the rich and corporations, it's no wonder that governments, especially very poor governments, are cash strapped to beef up their response. So now more than ever, we need a global response to this pandemic, and Canada can really play a leadership role. The next G20 meeting is happening on July 18, where finance ministers will discuss the debt crisis. And let's make our voices heard and tell the Canadian government to lead debt cancellation at the G20.
No, this is great. Thank you for your response, Deanna. Like, it's great to kind of see what role on an individual level we can play in what should be like global, international, cooperation and collaboration to ensure that we're all, safe and as healthy as possible. I think if there's one thing that the COVID-19 has showed is that we are all in this together, whether we like it or not, and it requires us working collaboratively. And so this has me thinking about what that collaboration not only looks like in Canada, but also on a local level with a lot of the countries that, Victoria, you mentioned. And I'm going to pose this question to you, Victoria. I wanted to know how exactly you, Oxfam International, are kind of working with local leaders and health experts in lower and middle income countries on advocacy efforts, just to give us an idea of what that looks like, if you're doing so, because I'm curious.
Yeah, great question, Debbie. So it takes a number of different kind of shapes and forms. Like our campaigns and advocacy work at Oxfam, as I'm sure a lot of your supporters know, is really multidisciplinary. There's a lot of technical expertise. There's a lot of information gathering, analysis, and then public mobilization and influencing work across with partners, with allies toward governments and other targets. So in this case, we're obviously working very closely with our Oxfam staff, partners, and allies in countries where Oxfam works and debt relief is desperately needed. So we work with them to gather information, analyze and develop strategies for influencing not only their local governments, but also to support influencing work at the G20 and other multilateral institutional levels. So we can use the experience that we gain from our teams in countries like Ghana or Nigeria or Zimbabwe, as I've mentioned before, to really advocate and push for the need, while they're also using analysis that we're able to provide in building their case toward their government in terms of why they should request debt relief, for example, how to access it and advocate for themselves, and also how to spend that revenue that is hopefully going to be sustained within their national budget. So that's one way, is working directly with our staff members in our country team offices, but also then their partners and allies at the local level to really understand, appreciate, and use the information about their local situation to advocate for change at multiple levels. And then we also work with allies who either represent healthcare workers worldwide, so for example, Public Service International, and also doctors and nurses directly. So right now, one of the activities that we're running at the global level across all the countries that are participating in the Cancel the Debt work is an open letter from doctors, nurses, and other healthcare professionals to the world's leaders to as a desperate call for debt relief so that they can keep doing their jobs to save lives. So it's really a multidisciplinary approach to bringing the voices of those affected directly to the influencing table in different ways.
Sorry about that, mic issues, but I wanted to say thank you so much for giving us a better idea of like what's happening internationally and what you're doing collaboratively. And Deanna, you too, for giving us an idea of like what the Canadian context is, because again, I always think it's important for us to understand global issues by looking at what we can do in our own backyard. So thank you so much. Thank you. This was an insightful discussion. And right now we're going to move to the audience Q&A period. Audience members, if you haven't asked questions yet and you want to, please feel free to write them in the chat box. We'll give you folks a little moments to do that. Please note that we might not be able to get to all the questions that you have, but just a few. And Lucy, actually, who was behind the scenes, will actually join us to let us know if there are any questions at all, and then we can continue from there.
There's actually no questions at this time. So Debbie, if you had any additional questions for the presenters, perhaps we could jump to those.
Well, I'm glad I came ready with one. And I think this one I'm going to ask Deanna, if that's okay. One, I think we're a feminist organization. I'm a feminist, and I'm very, very much so interested in what the Canadian government is doing from like incorporating a feminist lens to its foreign policy. And so, this is a feminist issue. And obviously, when you consider how poverty disproportionately impacts women and girls, I wanted to know, where does all of this, the campaign, these discussions kind of fit within the Canadian international assistance policy? And how exactly is Oxfam Canada working to ensure that Canada brings a strong feminist voice via its position in many multilateral institutions that it belongs to?
Thanks, Debbie, for throwing me a real good one. Yeah, that's a good question. So that cancellation is really just one part of the solution. There's much more that needs to be done to address the magnitude of this crisis. A few months ago, the UN called for $2.5 trillion to tackle the pandemic and prevent global economic collapse. That's a lot of money. And so that means on top of canceling the debt, rich countries also really need to increase aid and taxes. And to be quite frank, Canada has been a laggard when it comes to aid. Donor countries have committed to 0.7% of GNI for aid decades ago. And Canada's aid has been below 0.3% for decades now, which is way below the OECD average. And so it's really critical that Canada pays its fair share, exactly because it has a feminist international assistance policy, but also because it's now really clear that this crisis is disproportionately affecting women. So much so that the economic fallout has been termed a she-cession by experts, rather than a recession, a she-cession, not easy to pronounce. So not only are women at the front lines of this crisis, filling the ranks of essential workers and thereby exposing themselves to the virus, but they're also the ones seeing the largest job losses, as they are concentrated in sectors that have been hit hardest, like hospitality and services. But we all know these sectors were made up of some of the lowest paid and most precarious jobs, so women don't have much to fall back on. On top of that, we've seen domestic violence skyrocket as a result of the lockdown, and critical public services that women rely on have been shut down. And so this has led to a huge increase in women's unpaid care work, which is, again, makes it a lot more difficult for them to go back to work or find work. So this is true in Canada as well, and women are really feeling the added burden of having to do more care work. Just a couple of weeks ago, we conducted a poll that showed that 71% of women in Canada are feeling more anxious, depressed, isolated, overworked, or ill because of increased unpaid care work caused by the virus. And also women living in poverty and ethnic and racial minorities, as usual, were more likely to suffer economically because of the added care responsibility, and were 3 times as likely as white respondents to say they had to give up looking for work as a result of increased care responsibility. So considering the disproportionate impact on women this crisis has had, we really need a global feminist recovery. And I'm afraid if we don't prioritize women's rights and their health and economic security, we will lose decades of progress towards achieving gender equality. And it will once again be the women who face multiple levels of discrimination and marginalization who will bear the brunt. So that's really where Canadian aid can come in, to hold the ground on gender equality and ensure women and girls have access to key public services and to opportunities that support their economic empowerment and security.
Thank you so much, Deanna, for kind of walking us through and painting that image about what impact this pandemic is actually having on women and girls. And I haven't heard of the C-session term yet, which I also can't pronounce. And so I think it actually helps encapsulate what's going on right now, especially the economic impact. So thank you so much. While we were actually having this discussion, Lucy actually did get some questions from the audience. Lucy, would you like to kind of pose a question or two, and then I can kind of bring that forward to our guests here?
Sure. So the first question is from Rose. COVID-19 has brought a new energy and urgency to this campaign. What was the main driving force before the pandemic?
Okay, I like that one. Good question. Victoria, would you like to answer that one?
Sure. Sorry, I was just coming off mute. Great question, Rose. So debt is an issue that Oxfam has been working on for a long time. With a lot of our campaign issues, even if you don't see it in front of you on the screen in a webinar like this, we still have usually a pretty robust body of work happening behind the scenes, particularly in research policy and advocacy that we do. And just as a few examples, the landscape of debt work pre-pandemic is still complex, even though the pandemic has added to that complexity. There are a number of dimensions, and I'll just pick on a few that I'm aware of in terms of elements that we look at on an ongoing basis where debt is concerned. So there's a lot of dimensions to financial loans to countries, including like conditions that would usurp the autonomy of countries to, dictate what development needs to look like within their own best interests. So some lenders would put conditions on those loans that would change the way that a country might envision and enact what development is best in their interests. So, for example, promoting conditions that Oxfam believes worsen inequality, like the privatization of their healthcare or education systems, which we know has really horrible outcomes, not just for poor people, but particularly women and girls around the world. So conditionalities like that. And also, just related to that, there's a lack of transparency in terms of what a lot of these agreements include. So one of the challenges of this campaign, especially in the midst of a pandemic, is getting a full understanding and appreciation of exactly what agreements each country has, who they're with, whether there were conditions attached to them, what those conditions are. It's a unique situation across most lenders and most countries, but these are the types of elements that would drive our work on this issue prior to the pandemic. What the pandemic has added is an incredible sense of urgency. As I said earlier, not only is there a desperate need to strengthen health systems, but it is one of the only opportunities that we have in front of us where, with the right political will, we could free up huge amounts of resources for countries.
Great response. Thank you, Victoria. Lucy, was there another question that we could ask?
Yeah, we might only have time for one more question, but the next question is from Cantwell. Can you walk us through how we can take action before the G20 meeting? For example, who do we write to? Who do we tweet to, etc.?
Great question. And I think this is a perfect one for me to pose to Deanna.
Indeed. Shall I say, I'm glad you asked. So yes, this webinar is part of a larger campaign that we're currently running. And Debbie will show you at the end of the webinar on how to connect to the campaign. But basically, on our website, we have several actions set up. One is for you to sign on to our action to send a letter to the Prime Minister asking him to support debt cancellation, as well as mobilizing more tax revenues in Canada to support the domestic COVID-19 response. But you can also follow us on Facebook and Twitter, where we'll be posting more about the campaign and how to engage in it. So there's lots of ways to be part of the campaign and make your voice heard. The G20 meeting, as I said, is happening July 18. The finance ministers will be meeting at the time. So Canada's Finance Minister Bill Morneau will be there, who is also on Twitter and on social media. Again, you can just post right there what you want to let them know, and in terms of guidance of what to say and so on, just check out our campaign website.
Thank you so much. And I was going to say thank you both, Deanna and Victoria, for kind of sharing your knowledge and insight. And thank you to my behind the scenes folks, Lucy and Amanda, for all your help. I also want to thank you all, the audience, for attending our Oxfam Live on Cancel a Debt. Remember, just as Deanna mentioned, you actually can help. We have a call to action that I will pop on the screen, which will bring you directly to a letter that you can send to the Prime Minister right now, where you can help cancel the debt and save lives. So thanks again, everyone, for your attention and for all of the folks who've been involved with this. We really appreciate it, and we hope that you have a great rest of your day.
Thank you, Debbie.
Thank you. Thank you for hosting us.